Okay, so in today's talk, we're going to discuss what to expect after you have your knee replacement. So we're going to kind of review in broad strokes different aspects of the recovery from a knee replacement. The big emphasis on recovery after a knee replacement is physical therapy. I do a minimally invasive approach for my knee replacements where I come underneath the quad muscle, avoid cutting the quad tendon, and that does really allow patients to start recovering very quickly because there's just less irritation of the surrounding tissue. But it's still a knee replacement. The knees still get swollen, and you still really have to work hard in the first 6 weeks to make sure you get all the motion you need and you're building up the strength again in that leg. Typically, the first 2 weeks after surgery, a therapist will come to your house, and then after that, you'll go to a physical therapist to really work on some of the finer points of getting your motion back, getting your balance and stability back, and getting your strength back. Now, what is mobility like after a knee replacement? Everybody transitions from using a walker to a cane to walking independently. A lot of that really depends on what your strength was before the surgery. I'd say most patients are either almost done using their walker or are on a cane by the time they see me in 2 weeks, and then they're walking independently somewhere between the 4 to 6 week mark. Your big goal is to be able to bend your knee to 90 degrees somewhere between 2 to 4 weeks. The best way to get your motion is to keep the pain well controlled and to ice the heck out of that knee in order to reduce inflammation. That brings me to the next topic of kind of what medications are you going to take after the surgery. One category of medication is a blood thinner. I don't want you getting a blood clot. The good thing is it's incredibly uncommon, but we do put everyone on, my preference is aspirin because it's a very effective blood thinner, but it doesn't make your blood so thin that you develop terrible bruising after the surgery. The other major classification of medications that you're going to be on are things to address the pain. Now, people after a knee replacement get a nerve block that for the first 2 or 3 days after surgery really minimizes pain, which is terrific, and it really prevents you from ever having that big spike in pain that you're then chasing after surgery. Patients still do take oxycodone, which is a narcotic. Almost everybody is off that pain medication by 2 weeks after surgery, which is terrific. The other thing that we've really started doing effectively is adding other medications, non-narcotic medications after surgery in order to prevent an over-reliance on like the oxycodone. And then I'll say it again because I really believe in it a lot, is that icing is probably the best thing that you can do for this knee for the first 2 weeks after surgery because it just reduces inflammation, it reduces swelling, it helps you get that knee moving better. And I can always tell the patients who have been icing like crazy after surgery when I see them 2 weeks, in my office because their knee's not swollen, they're smiling, they're bending it really well. The next question I get a lot is, what about driving? Well, you need to be off pain medication and you have to feel kind of alert and with it and strong enough in that right leg where you can jam on the brakes and come to a fast traffic stop. That transition usually occurs pretty quickly in people with left knee replacement. The right knee, obviously, it's going to be a little slower because that's your driving leg. But again, the same rules apply. Off pain medication, you have to be alert and oriented and able to kind of stay with the flow of traffic, and you have to feel strong enough on that knee that you could jam on the brakes to avoid an accident if necessary. And the last thing is what to expect in terms of follow-up visits. I like to schedule a 2-week visit after the surgery, a 6-week visit after the surgery, and a 12-week visit. If you have issues at any time between then, you obviously can come see me any time, but that's a very broad summary of what to expect when you recover from a knee replacement.